be okay? Alright, so we're going to get started. My name is Mandy. I'm a pharmacist here at Sarasota Memorial Hospital, and today I'm going to be giving a presentation on a guide to living with congestive heart failure. So this could be useful for you yourself if you have congestive heart failure, or if you have family or friends with congestive heart failure, some things to know if they're coming over for dinner, or if you're taking care of them, some important things that will be useful for you. So a few of the objectives for this presentation will be to define what is congestive heart failure, to explain what some of the possible causes of congestive heart failure and what the symptoms may be, and explore some lifestyle choices that can help improve the symptoms of CHF and also prevent you from having to go to the hospital if you have congestive heart failure. We'll also finally discuss some of the medications that are used to treat and help improve congestive heart failure. So we'll start with what is congestive heart failure, which I'll refer to throughout the presentation as CHF for short. So heart failure occurs when the heart muscle is weakened. Basically, the heart cannot pump blood as well as it normally would. When the muscle is weak, it doesn't push out the blood at the same force or the same amount of blood as a normal heart should. Congestive heart failure equals heart failure or a weakened heart muscle plus symptoms of fluid backing up into different parts of the body. And those parts could be the lungs and your extremities and your abdomen. So we'll take a look at blood flow through the heart. So this is a little bit complicated looking, but we'll break it down piece by piece. So this lower part here shows the tissues and capillaries. So this is all of your extremities, your organs. This is where the blood is bringing oxygen to your body. Once blood goes to your body, it comes back to the heart in veins, and it enters the right side of the heart, which is right here in the blue in the middle. The right side of the heart then pushes that blood out to the lungs, where it picks up more oxygen so it can bring it back to the tissues. And it's a continuous cycle of oxygen going from the lungs to the body, and then the blood coming back to pick up more oxygen. Once the blood has picked up oxygen in the lungs, it then goes to the left side of the heart, which is here in red. The left side of the heart then has the job of pushing out that oxygenated blood to the rest of the body. So a couple of problems can happen when you have heart failure. So either the left side, the right side, or both sides of the heart can become weakened. When the left side of the heart is weakened, blood can back up into the lungs, which can cause some symptoms of shortness of breath, feeling like you can't breathe when you're exerting yourself. Like if you are walking upstairs or doing housework, you may feel short of breath. Or when you're laying down, you could also feel short of breath. And that's a sign of fluid and blood backing up into the lungs because the left side isn't pushing it out. The right side of the heart can also become weakened, and this can happen when the left side is weak and that blood starts to back up, or it can happen by itself. And when the right side of the heart is weakened, blood backs up into the rest of the body. So that's where you can have swelling in your legs, your ankles, your abdomen, even your hands. So there's two sides, and that's what causes some of those symptoms. But we'll look specifically at what can cause the heart to become weakened. So the main cause is heart disease. Heart disease is basically clogged arteries to the heart. So these are the arteries that bring blood to the heart to supply it with oxygen. If these arteries become clogged with plaque, which is caused by cholesterol buildup, it can block the blood flow to the heart and cause some of the heart muscle to die, which is what happens in a heart attack. So if some of that heart muscle dies, that causes the muscle to become weakened. Other potential causes of heart failure can include high blood pressure, because the heart has to work harder to push out against that pressure. Infections can possibly cause damage to the heart muscle. Heart valve problems. Alcohol or illicit drug use, specifically cocaine, is known to have some damage to the heart muscle. And then congenital heart defects, which are those that you would be born with. There are also some people who are diagnosed with congestive heart failure where the cause is unknown, so that's possible too. But these are the main and most common problems. Mainly though, the clogged arteries and heart attacks are the most common cause. So we talked a little bit about some of the symptoms, but here we'll go into depth about all of the potential symptoms that can happen with congestive heart failure. So shortness of breath, which I mentioned is caused by that fluid backing up into the lungs. This can become harder when you're exerting yourself, doing work, lawn work, housework, climbing stairs. That's when you can experience that shortness of breath. Or it could happen when you're just sitting still. You can have swelling of the feet and legs, which is that fluid building up into the lower veins of the body, or your abdomen also, which we'll talk about. You could also have a lack of energy because the heart is responsible for bringing the oxygen to your body through the blood. So if that isn't happening at the correct rate, that's when you can have feeling fatigued, like you're just tired all the time. That's a very common symptom. Difficulty sleeping at night because of the shortness of breath. Often the shortness of breath can become worse if you're laying down because more blood is in the lungs. So if you're laying down or reclining, you could have trouble breathing, which could make it very hard to sleep at night, leading to worse lack of energy or fatigue. And a swollen or tender abdomen, so when fluid backs up in the abdomen or in the veins that are supplying the organs in the abdomen, you can have bloating, feeling like you're full after just a couple bites of food. That's very common. You could have a cough, increased urination at night, or decreased urination. So both of these can happen. The increased urination could be from some of the medications that you're taking, but also heart failure can cause some problems with the kidneys potentially. And if that happens, you may have decreased urination. And it can also cause confusion or feeling like you can't remember things. So these are a lot of symptoms, and we kind of talked about a lot of things that can happen with the heart. So how can these be managed? How can you live with the fatigue, the shortness of breath? Well, there's a lot of things that can help improve those symptoms and actually help you get back to living your normal life. First thing is lifestyle choices. So your lifestyle is extremely important with congestive heart failure. First, limiting your fluid intake. Like we talked about, the blood and fluid backing up into different parts of the body. If you limit your fluid intake, that can help reduce that swelling and shortness of breath from occurring. Also, reducing the amount of sodium in your diet. We'll talk specifically about these choices in just a minute, but limiting the sodium helps your body not hold on to that extra fluid. When you eat a lot of sodium, your body retains fluid and water, and that leads to worsening symptoms of shortness of breath and swelling. Also, exercising as directed by your doctor. So sometimes with congestive heart failure, you may need to start very slowly because you may be fatigued easily, feel short of breath. So talk to your cardiologist or your primary care physician and see what the right amount of exercise to start with might be. And also limiting alcohol consumption, especially if your congestive heart failure is caused by alcohol. So some people have congestive heart failure specifically from alcohol intake, and then it's extremely important to limit or decrease or cut out alcohol completely in order to prevent the heart failure from worsening. So looking specifically at the fluid intake, how much should you drink? Or not necessarily drink, maybe eat. So the recommended limit for most people with congestive heart failure is between 1,500 and 2,000 milliliters of fluid per day. Now you might think, well, that's easy, I only drink 1 water bottle a day. Well, what else do you drink? How many cups of coffee in the morning? How many sodas? Do you have soup for lunch? Do you eat ice cream at dinner? Do you have Jell-O for a snack? So anything that's liquid at room temperature counts as a fluid. So water, soda, tea, coffee, milk, soup. 1,500 to 2,000 milliliters is about equal to 6 to 8 cups, 8-ounce cups, or 3 to 4 16-ounce water bottles. So if you have like a Zephyr Hills water bottle, 16.9 ounces is 500 milliliters. So it's important to remember 3 or 4 water bottles or 1 2-liter container. And sometimes if you're not sure how much you're drinking, if you notice you have a cup of soup, when you're done, fill up that can and maybe dump it into an empty 2-liter and see if you can, how much you're filling up throughout the day. So here we have the picture. The watermelon too, which is very high in fluid, can also cause some fluid retention. When you drink too much, your body holds on to that extra fluid and it builds up a lot of times in your ankles and feet where you can see significant swelling where you may press on it and it actually indents into your skin. and it can also worsen that shortness of breath or feeling like you can't breathe, especially when you're laying down. Now the sodium, or salt. So limiting your sodium, we typically recommend less than 1,500 milligrams a day. So 1,500 milliliters of fluid, 1,500 milligrams of sodium, and you should be good. So that's one number you have to remember instead of two. Now there's a lot of foods that are very high in sodium. You may think, well, I don't touch the salt shaker all day. Well, do you eat lean cuisine? So there's a lot of foods, deli meats, frozen dinners, canned fruits, vegetables, soups. All of the processed foods often have a lot of sodium because sodium is used as a preservative. So if it has a long shelf life, it probably has a lot of sodium. So something to watch out for is look at those nutrition labels. Try to choose low sodium, no salt added options, but be careful because some of those no salt added may still be high in sodium. So still take a look at the nutrition facts and look at what it says under the sodium. Another option is Mrs. Dash seasoning. These are blends of herbs and spices that don't contain any sodium at all. So this is a good way to keep your foods flavorful while also making sure you're limiting your salt intake and making sure you're staying under that daily limit. Also, cooking from scratch is a great option. I know it may take some time, but typically if you're making a meal, you're not adding nearly as much salt as you would as they add in the foods that you get that are prepared or processed. Now, in terms of this much salt, how much is that equal to if you are cooking? Well, 1 teaspoon of salt, table salt, has about 2,300 milligrams of sodium. So it's not a lot, but often you don't add quite that much. Usually you just add a little sprinkle with your cooking. Now I have a little game here. These are all some frozen dinners, and some might appear to be very healthy for you. So which one of these do you think has the lowest amount of sodium? Anyone have any ideas? The Stouffer's, the Fit Kitchen Bowl, that's chicken with cashews. We also have a Healthy Choice Power Bowl, which is a breakfast pesto egg scramble, and then a Hungry Man chicken that's fried, so fried chicken there. So everyone's shaking their head on the Hungry Man. We know Hungry Man's probably not the most healthy. I had one suggestion for the Stouffer's Fit Kitchen Bowl. So the answer is actually the Healthy Choice Power Bowl. Now, it still isn't that low in sodium, and I had to do a lot of digging to find one that was less than 500 milligrams. So the Healthy Choice has about 490 milligrams of sodium. So that's right at your limit, because typically I would recommend trying to divide it up evenly, about 500 milligrams between your meals. So 500 for breakfast, 500 for lunch, 500 for dinner, and then you make sure you're not going over that. This Fit Kitchen Bowl has over 900 milligrams of sodium. So that's about 2/3 of your recommended intake for the whole day. And you don't have to have congestive heart failure to think about limiting your sodium. It's also good if you have high blood pressure or hypertension to try to limit the amount of sodium that you're eating. Now the Hungry Man, you guys probably don't even want to know how much is in that, but it's over 2,000 milligrams. So that's all of your daily intake plus 1/3 of your next day with that Hungry Man. So definitely keep an eye if you're having frozen meals and frozen foods. Look at the sodium on the back and make sure you're limiting your portion sizes and choosing things that are low sodium options. Alright, so next we'll take a look at some of the medications that are used to treat congestive heart failure. There are a lot of benefits that come with these medications. There are many research studies that have shown that they can lead to, one, making you feel better or limiting your symptoms. So if you have that swelling, shortness of breath, fatigue, once you're started on medications for your congestive heart failure, those symptoms typically improve. They can also keep you out of the hospital. Now I know I work here, but I don't want you to be here. I want you to be at home, enjoying your life with your family, your friends, maybe your children, grandkids, going to the park with them. I don't want you to be spending your time in the hospital. And some of these medications can keep you away from here. They can also help you live longer. Now 100, that's a pretty good goal, I think. So the medications have been shown to do a lot of benefit in people with congestive heart failure. They can even help your heart muscle appear stronger, so your heart can improve over time once you're taking these medications. So we'll go into detail about some of the most common medications and also mention some of the others that are that can be used for congestive heart failure. We'll talk about ACE inhibitors and ARBs. We'll talk about beta blockers, aldosterone antagonists, and diuretics. So I know that's just gibberish with most of you out there, so we'll kind of explain what those are. First, we have ACE inhibitors and ARBs. So I have a list here of what that includes. Basically, all medications that end in pril, lisinopril being probably the most commonly prescribed ACE inhibitor, and then ARBs are medications that end in sartan, with valsartan and losartan probably being the most commonly prescribed of those. So you would be on one or the other of these. You wouldn't be on two. You wouldn't be on an ACE and an ARB. But these have a lot of benefits. First, they can block harmful stress hormones that worsen heart failure and can also cause your blood vessels to tighten. Just like we talked about, we don't want your blood vessels to be tight because that makes your heart have to work harder to push that blood out against that high blood pressure. They can also improve your symptoms of heart failure, help you stay out of the hospital, and increase your length of life and your quality of life. So these are great medications for heart failure. But unfortunately, all medications do have some potential side effects. So what side effects can these come along with? They can come with a possible dry cough, so feeling like you have a tickle in your throat, but no phlegm or sputum involved. And this is more common with the ones that end in pril, so this side of the list. If you do have a cough with one of these medications that you notice isn't going away for a long time, your doctor may want to switch you to one of the sartan medications because those are less likely to cause the cough. They can also cause dizziness. So anything that lowers your blood pressure, because these medications are also used for high blood pressure, can cause some potential dizziness, especially when you first start taking them. So I recommend trying to stand up slowly if you're getting out of your chair or out of your bed, and maybe have something to hold on to when you first start taking it if you do notice any lightheadedness or dizziness. They can change the potassium levels in your blood. So that's something that your doctor should be monitoring through lab tests, because very high or low potassium levels can be dangerous for your heart. And they can also have some impact on your kidney function. These are usually used to help protect your kidneys and help your kidneys keep working good, but they can cause a slight decrease in your kidney function when you first start taking them, so we do like to keep an eye out for that. Very rare side effect could be swelling of the face, lips, and tongue. So if you are taking one of these and you ever notice that, definitely go to an urgent care or emergency room immediately. Next, we'll talk about beta blockers. So there's 3 specific beta blockers that have the most benefit in heart failure, and that's carvedilol, metoprolol succinate, which is Toprol XL, which is specifically the long-acting version of metoprolol, and also bisoprolol. So these medications help regulate your heart rhythm, and they can slow down your heartbeat, which is good because it gives your heart time to recover between each beat so it can push more strongly. They can also help prevent heart attacks and help you live longer and stay out of the hospital. There are some side effects with the beta blockers though. Since they do lower your heart rate, they can cause some fatigue. You may feel a little more tired when you first start taking them. And they can also sometimes worsen your swelling or shortness of breath for a few days after you start it or after your dose is increased. So this is something to watch out for. But in the long run, they do help you feel better and keep you out of the hospital. So these are good medications. So dizziness is also a side effect and a low heart rate because they do lower your heart rate. And you may feel worse, as I mentioned, for a couple days after you start or when your dose is increased. Next, aldosterone antagonists. So that's a fancy word, but basically, these 2 medications, spironolactone and eplerenone, work by blocking these stress hormones. Aldosterone is a hormone in your body that can actually worsen heart failure. So these block those hormones. They help you live longer and help you stay out of the hospital. So also big positives. Some side effects that you may need to watch out for, though, are potential breast swelling or tenderness, even in men. So if you notice that you're having some pain in the breast area after you start taking one of these medications, definitely let your doctor know. And can also increase potassium levels in your blood. So we had mentioned previously about the sodium intake, limiting your sodium. Well, sometimes you may notice that there's salt substitutes in the stores. So I usually don't recommend using those salt substitutes because instead of sodium chloride, those salt substitutes are potassium chloride. So if you're taking medications that can increase potassium levels in your blood and then you're using a salt substitute that's made of potassium, that can cause double trouble. So watch out for those salt substitutes with potassium if you're on these medications. And finally, the most common medications prescribed for heart failure are diuretics, or what you may call your water pill. So that includes furosemide, which the brand name is Lasix, bumetanide, torsemide, and metolazone. So I have a little picture here of some snowmen after the holidays, and one of them says to his friend, "Looks like you put on a little weight over the holidays." And the other one says, "Yeah, but it's mostly water." So water weight is not good when you have congestive heart failure. Whether you probably actually prefer the fat weight if you have congestive heart failure. So these medications can help combat that water retention that can lead to weight gain in congestive heart failure and worsening of your swelling and shortness of breath. And they do that by removing excess sodium from the body. So water follows sodium. So when you eat extra sodium, water stays in your body, or you retain that fluid. These get rid of the extra sodium and that extra fluid follows. So they can help improve your swelling and your shortness of breath. They do have some side effects though, because the way that the extra fluid is removed is through urinating. So you will have to urinate more often when you first take the medication for a couple of hours. And they can cause dehydration if you overuse the medication or if your doses that's prescribed is too high for you. And they can decrease your potassium levels. So those are all things to watch out for with these. As I mentioned around the holidays though, we do have Thanksgiving coming up, also Christmas coming up, and you may be going over to friends' houses, family members, and eating foods that you don't know exactly how they cooked it. So let's think about, Thanksgiving, you may have some ham, which is typically very high in salt, maybe some buttered mashed potatoes, also high in sodium or salt, drinking some juices, maybe some cider. All of that could have a lot of sodium, a lot of extra fluid you could be taking in around those times. And in my experience, a lot of people end up in the hospital after the holidays when they overeat and overdrink, different fluids around the holidays if you have congestive heart failure. So make sure that you're limiting your portion sizes around the holidays, because you don't want to be home for Thanksgiving and then here for Christmas because you had a little bit too much sodium around that time. A way to prevent that is definitely keeping an eye on your weight and definitely, letting your doctor know if you're gaining weight over a short period of time. Some other medications that are commonly used for heart failure, which we're not going to go in depth, but if you do take any of these and you have questions afterwards, I'd be happy to talk to you about them. We have digoxin, Bidil, which is a hydralazine isosorbide dinitrate combination, Entresto, which is one of our newer medications for heart failure, Corlinor or ivabradine, also a pretty new medication for heart failure. You may need potassium supplements because those water pills get rid of extra potassium. So if your potassium levels go too low, you may need to take a potassium pill. And also blood thinners or anticoagulants. Because if you have an abnormal heart rhythm like atrial fibrillation along with heart failure, you may be at a higher risk for blood clots or strokes. So you may need to take that as well. So if you have any questions about these, I'd be more than happy to talk to you afterwards. There are also some medications that you should avoid when you have congestive heart failure, and that includes NSAIDs, which are non-steroidal anti-inflammatory drugs. So that's aspirin, ibuprofen, which comes under the brands of Motrin and Advil, and naproxen, which is Aleve. So these medications can actually combat some of the good things that the medications that you're taking do. So if you're taking lisinopril, which is one of those ACEs, these actually work against that and can cause worsening of your kidney function and also worsening of your heart failure. So if you do have minor aches and pains, I recommend Tylenol if you don't have any liver dysfunction. So if you have liver problems, you might want to talk to your doctor about what the best option for you is. But if you have a headache, arthritis, some joint pain, Tylenol is usually the best option for people who have congestive heart failure. So we talked about a lot of medications. And those medications, if you have heart failure, you may be on 3, 4, 5 medications specifically for your heart. So how can you remember to take them all when some are once a day, some are twice a day, some are with food, some are without food? Well, the best way is using a pill box. So a pill box, they usually come in different types where you can have one time a day. They may have a morning and nighttime, or a morning lunch and nighttime. This is a great way to keep track of your medications. Also, keeping an updated list of your medications is very important. With heart failure, a lot of these medications are slowly adjusted over time to get you on the best doses that have the optimal effect for your heart. So make sure you're updating your doses of these medications every time you go to the doctor. Also, charts, timers on your phone to remind you when it's time to take your medications. Or if you just find that you're doing these things and you can't remember to take them, or you're mixing things up, ask for help. Ask a family member, ask a friend, ask your spouse. See if they can help you try to organize your medications. Or also ask your pharmacist. If you pick up your medications out of Walgreens or CVS, definitely see if they can give you any tips for helping you remember your medications. Finally, there are some responsibilities that come with being diagnosed with congestive heart failure. Refilling your medications on time is a big thing. Showing up for your appointments and your lab work, as a lot of these drugs do come with some monitoring that needs to happen. Checking your blood pressure and your heart rate. A lot of these medications can lower your blood pressure, so if you find that you're dizzy, you're having excessive fatigue, definitely check your blood pressure, see what your heart rate is. If it's on the lower end, like less than 100, over 60, and you're having symptoms, let your doctor know. Or if your heart rate is below 60 and you're having symptoms of dizziness, call your doctor and let them know. Because of that excess fluid that can build up, it's important to weigh yourself every day. If you notice that you've gained 2 to 3 pounds overnight, or more than 5 pounds in 1 week, that could be a sign that you're holding on to extra fluid. So you need to call your doctor and let them know you're gaining some weight, you're having some symptoms, and maybe they can adjust your medications to help you stay at home and stay out of the hospital. Also, keep an updated medication list, as I mentioned, and call your physician or healthcare provider if you are having symptoms or noticing that you're gaining weight. So that's all I had. Does anybody have any questions about any of the medications? I know that was kind of a lot to go through in a short period of time, but if you have any questions or anything you're confused about, if you have congestive heart failure or know someone with it and have any specific questions, I'm here to answer them.
What about statins?
So statins aren't specifically used to treat heart failure, but are definitely important if you have a history of heart attack, high cholesterol, or different risk factors that can put you at risk for a heart attack or for that, because the heart attack causes the congestive heart failure. So if you have congestive heart failure because of that heart disease, you're most likely going to be on a statin.
I have vertigo. Every one of these medications causes dizziness.
Right, but the dizziness is related to blood pressure and not necessarily like an equilibrium in your ear idea. So the mechanism is a little bit different, so you might be able to tolerate these medications. Sorry, let me repeat that question for those people who are online. We asked if statins could be important in heart failure, and that is definitely true, especially if you have risk factors that can contribute to heart disease or risk for heart attack. And also, dizziness is a symptom, but it's a little bit different mechanism than vertigo, so it may not cause a problem. But if it does, definitely let your doctor know. Yes?
You just mentioned vertigo. Could that be a symptom of the heart failure?
So vertigo is dizziness, but it's not caused by low blood pressure typically. It's like an inner ear equilibrium usually, so it shouldn't, these medications shouldn't cause vertigo.
Even if it's with confusion also?
No. No, these shouldn't cause vertigo. That would be a dizziness from a different cause. Any other questions? I'd be happy to talk to you personally too if you do have anything specific to your own life.
I just want to add and reiterate what you said, and that is compliance and getting your medications filled on time is so important, because one of the main reasons why patients do end up in the hospital is because of non-compliance. So they stop taking their medications and will end up in the hospital with worsening congestive heart failure.
Yes, definitely.
Also, with the water pills that you have listed there, the furosemide, torsemide, butadiene, they're all very good, very effective. I find we most typically start with the furosemide, most patients, but if you find yourself or whatever family members not responding as well to that one, which is first line, I would really recommend to have the conversation about using the torsemide. It has a longer duration, better absorption, can be used even with renal, some kidney problems, and I have found it to be very, very effective with patients that have been getting worse and worse and worse and not responding to furosemide. Get switched to torsemide and could see very significant improvements. So just a little tip.
Definitely. And one other thing with the water pills, some people find, because it does cause you need to use the bathroom, you need to urinate more often. Some people find it's difficult to plan their day around that. Well, the furosemide, as you mentioned, is a little bit shorter acting, so you'll need to go to the bathroom mostly in the first 2 to 3 hours after taking it. So if you can plan when you're going to take it, take it first thing in the morning, then maybe go out for lunch around noon, you shouldn't have a problem. But also, since it does, sometimes people have to take it twice a day, and you may have to get up multiple times during the night to go to the bathroom. So if you are taking it twice a day, instead of making those 12 hours apart, you can take it at 8 a.m. and 2 p.m. or 8 a.m. and 5 p.m. to prevent you from having to go to the bathroom in the middle of the night if that's a concern that you have.
Does it take sometimes a little while for that to get regulated? I know I was taking that, and right when I first took it, I had problems biggest part of the day. I take it real early in the morning, but now it is settled down to doing what you're saying, about 2 or 3 hours.
Yeah, sometimes your body does get used to it a little bit, so that diuretic effect will be the most significant. When you first start taking it, you'll need to go all day long, but then your body gets used to it a little bit and you may become a little tolerant to the medication. But if it happens where you find that you're not having to use the bathroom at all after you take it, that might be a time when you may need to switch to another option.
And it's just, now I take it, and I'm assuming that's the way it's me, a short duration. You just take it a few days, and then I get off. I don't take it every day.
So that, it is sometimes prescribed like that. Sometimes it can be prescribed only if you notice that you've gained a certain amount of weight in a couple of days, or you notice swelling, then you should take the medication for 3 days or 5 days in a row. But sometimes it's prescribed every day. So it just depends on what your physician thinks is best for you.
The valsartan and the losartan were
yes.
taken for high blood pressure. Sometimes they have a water pill also.
Yes, sometimes those have another water pill called hydrochlorothiazide, or HCTZ, or chlorthalidone that might be combined with it. Those are water pills, but they are not used specifically for congestive heart failure because they don't work quite as potently. They're not quite as strong with that, getting rid of that extra fluid as the furosemide is. So those don't have as much benefit in heart failure as the other diuretics that we mentioned.
I take Eliquis. Is there anything that I can take that isn't so expensive?
So There are some options that are not quite as expensive as Eliquis, but that's something you need to consult with your cardiologist about or whoever is prescribing the Eliquis for you. We have several different blood thinners that are available. We have dabigatran, we have Xarelto, we have warfarin. So warfarin is usually the most cost-effective option, or Coumadin, as you may have heard before, but it requires more consistent monitoring of your blood. It also, you may have to make trips to the doctor's office 2 times a month to every month. The longest period that you'd be able to go without going to the doctor is 12 weeks, and that's only if you're very, very consistent on the medication. Also, the Eliquis, for some people may be a better option if you have a high risk of bleeding. So it's definitely a personalized decision, but if you contact your insurance company and maybe see what the prices of the Xarelto or the dabigatran, you might want to see what their prices are and see if those could be potentially a better option for you. A lot of things come into play with the blood thinners: your kidney function, your risk of bleeding, the reason you need to be on the blood thinner. It's a personalized choice, so definitely you can ask your doctor if there's another option that might be less costly to you. Because if you can't take it, then it doesn't give you any benefit at all. If you're paying $400 a month for the medication and you can't sustain that, there's no benefit whatsoever if you're not able to take the medication. So if another medication may have similar benefit but is much less costly, that could definitely be something you could talk to your doctor about.
What's some of the side effects of warfarin for the kidneys?
So the question was, what are the side effects of warfarin for the kidneys? And warfarin is actually one of those medications that you can take regardless of your kidney function. So even if your kidneys aren't working at all and you're on dialysis, you can still take warfarin. It doesn't actually cause any harm to the kidneys whatsoever, and it's not eliminated through the kidneys mostly. So that's one of the medications that even if you have very poor kidney function, you can still take. Any other questions?
I do have a question relating to the cost of prescriptions and talking to your doctor. Is that something that, I don't know, as a pharmacist, that you see it comes up a lot? And what is your recommendation, like, for the patient to do some research on their own, or maybe talk to a pharmacist first before asking their doctor about alternatives, or just the fact that you're actually asking at all?
Yeah, just asking at all is usually the first step. But you can always do some research at home. Maybe talk to your pharmacist, see what other options there are that are similar to the medication that you're taking, and then you can research through your insurance company or online for coupons that may be available to you. Sometimes there are coupons for the very expensive medications, but usually those are only good for a certain period of time. So if it's only good for 6 months or a year, and then you have to switch to something else, it still might not be the best option for you. So bringing up the concern to your local pharmacist at Walgreens or CVS, and then seeing what other options are similar to what you're taking, researching those options, and then bringing those back to your next doctor's appointment is probably the best way. Another pharmacist here, Michelle, you deal a lot with the cost of medications. What do you think?
I would say for sure letting your doctor know, because a lot of times they might not know that that's something that's keeping you from taking your medication. So be open with your doctor about it, and the insurance company is a great place. Make a call. I will say that Medicare does have a lot of rules, but we can use coupons and different programs. There are. I guess we're in open enrollment now too. So if you have questions on if you are using Medicare, there are resources available for help on finding different Medicare options as well.
Yes.
I noticed one thing. I take Coumadin, and just so many things. Some of your medications affect it. Price-wise, it's good, but then too, doctors got me going to the clinic, which the hospital sponsors
the
them.
clinic.
And I mean, it's just like going to the doctor's office. Although you don't have a problem with appointments, you can get them anytime. And that's worked really well for me. The only aggravation I've had with it is the too much, this medicine will affect it, that food will affect it.
Right. So there are some definite considerations with Coumadin or warfarin, which is one of those blood thinners. Foods definitely can interact. Foods that are high in vitamin K, which are green leafy vegetables. Actually, mayonnaise actually has a lot of vitamin K. Some things that you wouldn't think about if you have to kind of keep your diet pretty stable. We don't recommend avoiding green leafy vegetables, but keeping your diet consistent from week to week, where you don't go on a salad binge, a diet for 2 weeks, and then no vegetables for the next 2 weeks, because that will cause some significant fluctuations. Also, there's medications that can interact. And it's always important to, mention if you get some medications at one pharmacy and some medications at another pharmacy. If you know you're on one of those higher risk medications, just say, oh, by the way, I'm on this medication. Can you see if that interacts with anything that I'm filling today? Because not all systems talk to each other. So if you get some things at Publix because they're free, like lisinopril, one of those medications is free at Publix. So you might get the free ones at Publix, and you might get the warfarin at Walmart because it's one of the less expensive at Walmart, and then you may get everything else at Walgreens. So definitely talk to the different pharmacies and let them know what you're taking that they can add on to your list, and just make sure there's no drug interactions. Yes.
That's one thing you brought up there that really, I'm older and I get confused anyway trying to, with medicine, it's terrible. One day you're taking an oval yellow pill for this, the next prescription you get, it's around maybe a white pill,
Yes.
same thing.
Different
And trying to
manufacturers.
keep, and I'm not all the way out of one of them, and then I'm switching over to the other one. I mean, that's really confusing. Seems like they could have that, at least the same color pill, same number on it or
Well,
something.
with the Coumadin or warfarin, it will
Yeah.
always be the same
Yeah,
color
warfarin,
unless you
warfarin,
change
warfarin.
doses, no matter what manufacturer you get. But that is, something different manufacturers make the pills look different. That's why it's important to read the label. Make sure you're following the instructions from your doctor, because they may slowly be increasing your dose, but they may have written a prescription for lisinopril 10 milligrams. And so you got 10 milligrams, but then 2 weeks later they say, okay, start taking 2 of those. So make sure you write on your box or update your medication list for exactly what you're supposed to be taking. And try to keep your medications in their original containers. I find some people dump them all into one container, not a pill box, just a bottle. And it's very hard to keep track of if you do that, because they can sometimes look different from prescription to prescription. So I don't recommend doing that.
Last question
Yes.
regarding the pharmacy. So if you do use multiple pharmacies and you're trying to update each one on what you're taking, is there a specific, I would imagine that, if I work for Publix pharmacy and someone's bringing me their medication list, it's going to look different how I note it in the account, but can people bring a handwritten note, or do they need to bring the bottle so someone can look and make sure, or is it not that technical, just as long as they're aware?
As long as they're aware, it should be fine. If you just bring in a handwritten medication list with your updated doses and prescriptions that you're taking, it's just so they can make sure there's no interactions with the other drugs. They don't necessarily need the prescription number and who prescribed it and all of that.
Because I'm out of breath a lot, I used Anoro once a day. Is that recommended for people with heart conditions?
So Anoro is an inhaler, so that's used more. It's used commonly for asthma and COPD, which are lung conditions. And the shortness of breath in heart failure is not really a lung condition. It's a fluid buildup condition, because the heart isn't pumping the blood forward. It's a backup of fluid. So the inhaler won't improve shortness of breath due to that fluid buildup in the lungs. It improves shortness of breath related to asthma and COPD. But there's no contraindication or no problem with taking that inhaler if you have congestive heart failure. All right. Well, if anybody has any other specific questions, I'll definitely be available for a few minutes afterwards. But thank you.
Thank you.
Thank you.